Maybe Kim can start while everybody starts joining and just kind of giving a little bit of background on the state of play on where she sees
That's a great idea.
everything going from her perspective and kind of her background.
Yeah, that's great.
Sure. Hi, everybody. So I'm Kim. I'm Kim Yousey-Hindes. Put my last name in. I work in Connecticut. I work for the Yale School of Public Health. I'm also an alum of the Yale School of Public Health. I have my master's degree in public health. So I'm an epidemiologist at the master's level. I'm not a physician. I think a lot of the people you hear from on the news are physicians, so they're clinicians, and they're giving you medical epidemiology information. What the CDC tends to be. So I have a master's degree in public health, so I won't be answering, clinical questions today, although I will be happy to direct you to other resources for that. But I'm an epidemiologist from a disease surveillance standpoint. So in my daily job, I track folks who end up in the hospital with influenza. So doing surveillance for sort of severe cases of the flu. And now, given the current situation, I'm starting to do the same kind of surveillance for people who end up in the hospital with the new coronavirus for COVID-19. So I do that work with the State Health Department in Connecticut. Our folks are partners at GPH up in Hartford, and I do that work with partners at the Yale School of Public Health, and then also with the Centers for Disease Control and Prevention. So they are our funders and our partners in all of this work. So I have lots of great colleagues and lots of great resources open to me to help to sort of understand what's happening. And I think I bring some of the language that's being used in the news today. It's not new to me. That's sort of what I'm used to talking about every day at work. So I'm happy to help answer questions that you guys have, but I didn't really bring like a presentation per se to share with you. I'd rather, speak directly about the things that you guys want to hear about.
Great. Thanks, Kim. So just for everybody online right now, would you turn your cameras off? And would you mute your mics as well? We're trying to preserve bandwidth and we want to make sure that no words are missed right now. So please turn mics off and cameras off, please. Okay, so I'm going to ask this first question here. This might be which is more of a clinical question here, but here's the question. I have a 21-year-old child with allergy and illness-induced asthma. Even with a common cold, they may present bronchitis or some other respiratory condition. I've received confusing information from various healthcare practitioners. From they're young and otherwise healthy, they'll be fine, to they're considered a risk despite their youth. Do you have any top-line thoughts? Obviously, you can't speak to this case in particular, but just sort of a top-line thought on the different ends of the population that are at risk and what levels of maybe concern in terms of reporting that risk would you have at this point based on the evidence we have thus far?
Sure. So for this particular person, this 21-year-old, I am not the best person to comment on that. Their physician who knows them the best, or their clinician who knows them the best, should be working with them in case they get sick, which they may not. What the data is showing, and new evidence is coming in all the time, but what the data is showing that we have so far is that young people do tend to do well with this infection, that they may do so well that they don't even show symptoms if they are infected. So like even though they may be able to, you might be able to culture a virus from the person, that they might not show symptoms at all. And that's young people like 18 and younger than that. So by and large, this person is 21. That's still very young. And so in general, that all the evidence is showing that people who are young are not likely to get severely infected in general. And again, so like I'm an epidemiologist, so I think about the health of the population and not the health of individual people. So on a population level, the younger people are really doing pretty well with this virus, and they're not, by and large, getting severely ill. But some of the groups that are getting severely ill are people who have underlying conditions. In general, those are the older people, so over 60, over 70, depending on how you want to categorize older people, especially if they have conditions already that would affect their lungs, or they have conditions already that would affect their heart. So the sort of groups who you already think might be at a disadvantage if they got an upper respiratory infection of any kind. So yeah. Oh, are you muted, Justin?
Sorry, I'm back. There we are. Sorry about that. No, that's great. Thank you very much for that. Is there anything prevalent in the media right now? I kind of want to start on this macro level. Anything prevalent in the media that you've been seeing reported that you have found very inaccurate, or I want to say particularly premature at this point, that you feel like is being presented in a way that's not accurate?
I think the public health messaging, and maybe this is all the time, public health messaging is hardly ever sexy, right? And so what the media wants you to do is watch their feeds, or turn to their channels, so they're gonna put out the clickbait stuff. So it's tough. CDC and NIH and WHO has to compete with things that are more interesting, like empty shelves and panic, because that's what I think people think are interesting headlines, where the public health messaging is not so exciting. So I think in general the media get around to promoting science-based public health messaging eventually, but they always lead with something a lot more scary and intriguing at first.
How do you feel the government as a whole, and not necessarily talking about the state of Connecticut, but just sort of in general, how has the response been that you've seen thus far in relation to how serious this virus is?
Yeah, I mean, there's the government, and there's the government. There's various branches are doing various things. Sometimes it seems like they're in competition with one another. In general, some folks are doing an excellent job. So like Anthony Fauci, I would trust that guy. Anything that comes out of him he's a fantastic spokesperson. He's an excellent scientist. It's so great that we have him at the National Institutes of Health. Any work that he's doing, any message that he's giving is very trustworthy and tends to be up to the moment. NIH is doing great. The government had some trouble with testing, right? You can sort of ask anybody, did we screw up with getting testing sort of ready and rolled out early enough for this situation to really sort of best be able to cope? And it seems like we really weren't quite up to the task there. I don't know the details about what caused the delays, but we could have done better there.
Based on that, and based on the evidence evolving, is there any hypothesis at this point as to when the peak will be? Obviously, that is hugely dependent on the response from the states and the federal government, and also how seriously people react to the information that comes down. But is there any idea as to when this might peak at this point? Are we sort of just entering a phase-up period right now? And also in tandem to that, is there any, we've heard stuff like when the weather hits 80 degrees and above consistently, perhaps in June, that this will drop down in a significant way. Do you have any thoughts on any of that?
Yeah, I mean, that's sort of quite a few different topics we could talk about there. When you say sort of when is the peak going to happen, I think the past couple of days, I feel like there's been a lot of discussion about the flattening of the curve, right? So that's sort of the whole reason behind all these social distancing measures that are being put into place now. So school closures and restaurant closures and now curfews. So all of that is hoping that the peak won't happen anytime soon, right? Because if we had this really sharp increase, this really high case count all at once, we just can't handle that. I mean, every flu season, as just sort of business as usual, a lot of hospitals will run out of their inpatient beds or their ICU beds just because of the regular, somewhat anticipated surge that comes with the regular wintertime respiratory viruses that are out there. And so with this one, being a brand new virus that no one has any pre-existing immunity to, so meaning everyone is potentially susceptible, if everyone gets sick all at once, we just don't have the healthcare resources to deal with that. So what we want to happen is that the peak is not going to happen anytime soon. We want it to almost not have a peak at all, but just be this really long, drawn-out, sort of slow burn of the virus spreading slowly throughout the population in a way that our healthcare resources can handle it. So anybody who needs that extra level of care, there will be a bed for them at the hospital, or anyone who needs to just go visit their doctor and get a new inhaler prescription and then be sent home can do that, and it won't overwhelm the system. So when the peak happens really depends on us and how well we are at implementing these social distance techniques. And we may be able to see how well that plays out if it continues like this, where different states are doing different things or different countries are doing different things. It's sort of a great big natural experiment to see how well these implementation measures are carried out. So that's the peak. But you also asked about like summer. So I'd say that's a little bit different. Summer, we like to think that things like influenza go away in the summer, and there is some research to show that viruses like the flu don't travel as well in like a high humidity, high heat environment. There's some science behind that, and so that's some of the reasons behind the seasonality we see with viruses like influenza being more active in the winter and less active in the summer. Coronavirus is not the same as influenza virus. Some of what leads to seasonality of viruses is sort of how many people are susceptible in the population, and we've got lots of those. We've got lots of people who could still be infected with this virus. So I don't think there is much science to say that the summer months per se will change the activity. I think there isn't much science yet to say that. So I can't say yes or no about the summer.
That's great information. And based on that, you hear a lot of people talk about, oh, this is just an extreme version of the flu, or this is sort of an altered flu pneumonia hybrid. Is there enough information at this point based on the studies in China, Japan, South Korea that sort of establishes more of what this is? Have you learned anything?
Studies are coming out all the time. So case studies are out about some of the very first people who were sick in China, and the WHO mission that went into China, and they did some extensive studies, and some of those are published and are available if you guys want to, look up the details. I would say comparing it to influenza can be helpful and can be misleading. So it's similar to influenza in that, a lot of people have had the flu, and they can think back and remember, like, oh, yeah, I felt terrible. I had a high fever, and I coughed for weeks. And, maybe if those people, have underlying conditions, they really did have a hard go of it. Maybe they were in the hospital. And this virus can lead to things like that as well. But what we're seeing so that's like an individual's experience, right? So an individual's experience who has had influenza in the past could end up, getting sick with this virus and feeling like, wow, this really does feel like the flu. This does feel like the last time I had influenza. But then if you look at sort of the comparison on the big population level, right, which is what epidemiologists like to do, if you look at the big picture, it seems like the data is showing that this virus is more deadly to a population than influenza is. So every year people die from the flu. A lot of people die from the flu because a lot of people get sick with it. But it looks like at least, 10 times more people so far are dying from this new coronavirus infection. And again, if our healthcare resources get overwhelmed every year by just the flu that we're anticipating and that we can treat and that we have a vaccine for, this is a much bigger deal because we don't have specific treatment, we don't have specific prevention measures, and we have a very susceptible population. So similar to the flu, maybe for an individual experiencing it as a sickness, but a much bigger deal compared to flu on a population level, if that makes sense.
Yeah. So do you have any recommended protocols on social distancing? Everybody hears social distancing, and a lot of people are confused as to what that means. Does that mean I have to stay in my house with the doors locked and the windows shut for weeks on end, or does that mean I can go about my normal routine but just keep 6 feet away from people? Are there some established norms as to what that means? Because I think that confuses a lot of people.
Yeah, I think this is a new thing for everybody, how we can best implement social distancing. I've certainly never lived through this before. So I am a mom of 2 kids. We had no school today, so all 4 of us, my husband and my 2 kids and I, we were all in the house for most of the day, just giving our personal example. And the doorbell rang this afternoon with kids down the street who were also out of school wanting to play with my kids. And my kids were all psyched to go outside and play. And I said, hey, guys, we can't do this. Like, no school means no play dates. So, every family's going to have to make their own decisions. So maybe other people would have said, well, if the kids were each outside on their own bicycle, being 6 feet away from each other, maybe that would be okay. And I'm definitely okay with kids being outside. So we live in a house that has a yard. So thank goodness, because there's no way we can all just stay shut up in our house for the foreseeable future. So to me, being outside is fine, but interacting with other people, especially people who could be in these higher risk groups, so the elderly, people with underlying lung, heart disease, we're going to definitely not do that. So my in-laws live right down the street. We usually have Sunday dinner with the whole family. So there's 3 generations. We're all around the same table, and we have already emailed our family that's in town to say we're not doing that. You guys can choose to do what you want to do, but we won't be bringing our kids to Grandma and Grandpa's to all share, a family meal together because of social distancing. So in general, the big take-homes are like you should be interacting with as few people as possible. I'm working from home. My husband's working from home. My kids are going to school. If you can do that in your family, great. Especially if you can keep your incomes coming in. I have a relatively easy, row to hoe in terms of that because I work remotely most of the time. So, as sort of as best as each family can reduce the number of people they're coming into contact with, the better.
Right, but this isn't a snow day, right? So people need to understand that this is not a situation where, as if schools are closed for a blizzard or something like that. Your thoughts are that this shouldn't be treated in that way.
No, and that's what was the hard lesson for my kids today when the neighbors came over and were like, great, let's go play outside. It was a total shock to them that to me, this meant that they couldn't come in contact with those kids, which they totally would have on a snow day. This is going to be a long haul and a totally new normal.
Is this the end of the school year for people? Do you think? I'm obviously that's a question that you obviously going to have a firm answer on. But does it seem like the 2-week window? There's a lot of people that are really banking on this 2-week window that a lot of places have employed and really thinking that that's the hard end of this. That we'll be back in a couple of weeks, right back to normal. Does that seem like that
would be a nice thought, right?
Thing?
I can see why people want to see the light at the end of the tunnel. I am not operating under that assumption at all. For social distancing to be most effective, it can't be limited to 2 weeks, right? Remember, the whole goal is to keep flattening that curve and trying to avoid this, rush on healthcare services by having lots of people get sick all at once. So we really need to try to do social distancing for as long as we possibly can. And 2 weeks, I don't think we'll have enough of an impact to be effective. So I know, I'm a lecturer at Yale School of Public Health, and they have gone to, distance learning for the rest of the year. I think that most other schools may keep moving their sort of the end date, that whatever it is that they've announced so far, that may keep moving. I think it's a moving target. That would be my prediction.
Okay. I'm just chiming in. I see some additional questions here, and thank you for doing that via chat, everybody. I'm just going to jump on a couple here. Is there any information as to how this is different from SARS or H1N1? Why does this seem a lot more severe and a lot more and a lot longer lasting and prevalent through the population than those?
Yeah, there is research. So those were a few years ago now, so there has been time for sort of research to come out and be published. So SARS was in 2003. That was another coronavirus, so that has that in common. But SARS, by comparison, was more deadly. So we're winning in that aspect, but not as easy to transmit. So the new COVID-19 seems to be very transmissible. Luckily, SARS was not, since it was so deadly. We're very lucky it was not as easily transmitted as the current coronavirus. Mainly, it was healthcare spread, so there were a couple of pockets of sort of outbreaks. There was Hong Kong, and then there was a Toronto outbreak, and the public health measures were able to sort of really put the kibosh on that, and we haven't seen SARS again since then by 2004. So that's very different than what we have now. Not many total cases. We're well past the total number of SARS cases. I think there were only a few thousand, but don't quote me on that. Then H1N1. So SARS wouldn't even qualify as a pandemic, I don't think. H1N1 was a pandemic. H1N1, if you remember, was 2009. That's an influenza A virus. So it's not coronavirus. It's a different kind of virus. It was a pandemic, so there's that in common. Lucky for us, in 2009, the H1N1 pandemic was not as deadly, not as hard on the population as the current coronavirus pandemic is. In fact, it impacted younger people. Younger people were more susceptible to infection with it than older people. It seems like the studies are showing that older people, I forget what the cutoff was, but say, 60 or older, tended to already have pre-existing immunity to H1 influenza A viruses at that time because they would have been exposed to similar viruses when they were kids. So they had that immunological memory already when they were confronted with this virus at that time. And we don't have that. So that's a real advantage, right? And it was only an advantage in the older population then for H1N1. But still, that's an important population that you really need to protect because they have other issues that make them frail or less capable of fighting back against a viral infection.
Yeah.
And in this situation, no human being in the whole world, except for the people who've already recovered from the current coronavirus, have any cross-reactive or memory-based immune system that can fight this. We're all susceptible, so it's a totally blank slate for this virus.
That's really useful to know that it seems to be the from a practical level, it's the contagiousness that seems to be the prevailing theme here with regards to this virus in comparison to those others. I think it's a very useful way to the average person like myself to who doesn't understand the science obviously as well as you do to really grasp on to what this means for everybody. Is there any, and this is based on kind of what you just said, is there any information yet? My hunch is perhaps a little too early, but is there any data yet that suggests that people who recover from this, who lose the symptoms for X amount of time, that they've gained immunity? From what I've heard, I've heard sort of mixed opinions on this. I've recently read the Reuters that that there at least one person who has regained it. Now I don't know. You could speak to this, whether perhaps the virus remains dormant in the system for a period of time. They just happen to have it in the system for a much longer period of time than the common flu, for instance. Any information on that at this point?
I think I've seen what you've seen. There was sort of, again, like a scary headline, like reinfection. Was it Japan, maybe? So there is that. So somebody floated that piece of information. What I read, I think in that same article that, again, had the scary headline, when you actually read sort of through to the end, they're still double checking, right? So maybe that was just like a false positive, or, you know, an issue with the testing that was done. So I think the jury's still out on that. What does seem to be more scientifically backed right now is that people are achieving some level of immunity. So you can measure that in different ways, but, you know, some people who've had the infection, you can test them again later to see if they're negative, at least, right? So like you're saying, the virus doesn't just stay. So there's a few different topics there. So I have seen evidence that people who were sick, once they sort of start the recovery process, so say they've stopped having fevers, they're less symptomatic than they were, they're clearly on the road to recovery. I forget where this data was out of, maybe Germany. But by about, you know, more than a week, so say 8 days after they've started to recover, you can't recover like live virus from them anymore, which means they wouldn't be able to transmit. So that's great, right? So that once you've had this sickness and you're on the road to recovery, from about 8 days after that, you're not going to make anybody else sick. Then, separate from that, is are you now immune to reinfection? And the answer to that, I don't know. I would say hopefully, and that's what we want, right? Because you want to know, I mean, for lots of reasons, but we want to know that having a vaccine for this kind of virus would work, right? So we want to know that sort of teaching your immune cells how to fight it is what vaccines do. And so we want to know that once you do have some immune cells that have been trained to recognize this virus, that'll be enough and it will help prevent future infection. So I'm not sure about the data for that, but I'm hoping that we do have that information out there.
So it's going to be a little bit of time before we understand when someone is not a vector anymore. Is that correct?
So by a vector, so do you mean by someone, whether they can pass on the virus?
Spread it, yeah.
Yeah, well, so that's, yes, somewhat the jury is still out. So part of that answer is these people who obviously have an infection, they've tested positive, they're symptomatic. The studies are showing that by 8 days, they're not able to pass it on anymore. But there still needs to be more research on people who could be passing the virus pre-symptomatically, meaning like before they're symptomatic, or even asymptomatically, meaning they may never show, let's say, strong symptoms or even recognizable symptoms. So it seems like that that may be what's happening with some kids, is that you would never even know that they were sick, but they may still be able to spread the virus even though they don't look sick. And that research is still coming out.
That's great. Thank you very much. One other one I've seen here. Somebody's curious about experimental treatments and success that they may have had dealing with drugs. You know, for instance, example, when people used different combinations of drugs to treat HIV. I'm assuming we're a little bit early in the process yet, but I guess the top line question would be, is there any expectations? So obviously vaccine's not going to be out for what, probably a year at least. So in the meantime, for people who have it or are going through the process of obtaining it, is there any sort of thoughts on that there are existing cocktails and medications out there that will that they will find a sweet spot as to a different combination of the drugs that might work to help this that already exist?
Sure. I mean, there's lots of hope out there, right? And so there definitely are some medications. Again, I'm not a clinician, remember, so this is not my area of comfort, or definitely not my area of expertise. But yes, there are various drugs out there right now that were developed for other reasons that are now going to be tested or attempted for these cases that are hospitalized with coronavirus. There are multiple vaccine trials going on. I think I heard that this week phase 1 trials for some of the first potential vaccines are starting, which means sort of the first experiments where you try to see how well the vaccine is working and how safe it is, which is amazing, that we're already there. So potential vaccine candidates exist. We just now have to make sure that they're, one, working, 2, not going to make the disease worse, and then 3, safe to use in humans. So you have to go through a lot of testing before you can sort of answer all those questions and roll it out to a wider population, and that's what takes so long. But yes, there are medications that already exist for other things that folks are starting to use against coronavirus, and the hope is that they may have some effectiveness in the disease surveillance work that I do. So I follow up on cases that are hospitalized with their coronavirus infection or their influenza virus infection, depending on which hat I'm wearing every day. We collect information about which drugs were used to treat these people. And in that way, when so when I collect that data on, say, 100 patients, and then my colleagues in 10 other states collect that data, that's how we can learn whether it's working or not, right? So we can pool that data and we can say, wow, so all the people who were treated with, I think remdesivir is one of these potential medicines. And like all these people that got remdesivir, they had pretty good outcomes. So maybe it's possible that the remdesivir is working. We should get this into a trial where people are actually, it's more of an experiment where you purposely give people that compared to another drug, and then you measure to see how well they come out with their outcomes. We can do that based on our surveillance data that we collect on everybody who's hospitalized with these cases, and start to learn, hopefully pretty quickly, which drugs seem to be working, which drugs seem to be safe, so that we can get those messages out to hopefully get people on the right track with the treatment options that we already have out there.
That's really helpful. Thank you. There's one question here that is probably more for a physician, but I can probably reframe it a little differently. Some question in regards to how to treat some symptoms, but I think moreover, is there, if you're symptomatic, this is the question, and told to stay home. Is there a website or any resources out there that might be constantly evolving and updating that are current in regards to treating the symptoms at all? Any resources out there that are really helpful and reliable?
So my first go-to is always the CDC website, and they are updating it constantly. And I know that most health departments, whether they're local or their state, they're just pointing their, websites right to the CDC website, because that's sort of the mothership. All guidance tends to come from the Centers for Disease Control and then get disseminated down to the local level. I would certainly go there. Again, I'm not a clinician. I have a master's in epidemiology, not a clinical degree of any kind, so I'm not good at giving treatment advice. But yeah, I guess I'll stick there rather than say something wrong. I would say going to CDC's website is a great start. And really, if you're sick and if you've been to your physician and your physician has deemed you sort of okay to wait this out at home, then you're really going to treat it the way you would if you had a flu infection or a cold infection. So whether it's like a regular cold virus infection, so whether that's NyQuil, whether it's some kind of tussin for a cough, whatever sort of normally makes you feel better. If that's chicken soup and tea with lemon, you go with that.
Great, that's super helpful. Senator Duff, I have a question that just popped in for you, and since we have you here, this is from a real estate agent who's licensed in Connecticut, up in Granby. He's concerned about town halls that are closing and probate courts possibly closing as well. He's concerned. He just wants to know: is this really necessary to close these town halls in the probate proceedings? His comment was, I would think it's prudent to keep our state's fragile real estate market moving along. And some concerns about the trickle-down effects in regards to self-employed people.
Thank you.
Top-line thoughts on that?
Yeah, sure. I mean, I would just direct the person who asked the question to all the comments that have been made over the last hour with regard to keeping everybody safe. The health and safety of our citizenry is utmost important right now. I mean, this is an unprecedented type of event we have here in this country, and frankly, probably around the world. And so there's not a playbook which we could say, here's what we did last time. It doesn't exist. But first and foremost, we have to keep people safe. And we're all concerned about the economy and the economic implications and the disruption to business and families and people's incomes. It's terrible. It's unprecedented. And, it's one that we're going to have to all get our arms around in the short, medium, and long term after, as this thing progresses and once it's over. So, Mayor Rilling made the right call today by closing down City Hall. Absolutely the right call. And we, talk about social distancing and as contagious as this is. And probate courts have been talking for the last few days on their best guidance as well, as far as town clerk's office where you file these things. But, I'm not sure I would recommend, I'm a realtor, been a realtor for 25 years. I'm not sure I'd recommend people going out with folks right now, going and looking at houses. And that may sound extreme, but again, this is a very contagious virus. It spreads very rapidly. And you should only be right now with members of your immediate family. As we heard before, I've told my parents the same thing. They live across town. Sorry, we're not seeing each other right now. You need to stay safe. We need to stay safe. We'll see you on FaceTime. And that's the best advice we can give right now to blunt this very dangerous and contagious virus.
That's great. Thank you. One more question along sort of those lines in regarding small businesses, and either maybe you or Representative Dathan can speak to this. During this period of time, obviously during this period of time, we're just trying to get through this day by day. So probably this couldn't be framed for this period, but perhaps soon after this, has there been any sort of forethought to creating a panel of small business owners, members of the local stakeholder, and members of the local and state government to talk about cash infusions and how to prop up businesses that have been impacted by this?
Well, yeah, I want to just assure people that at the state level anyway, and I think we've had very good communications over the last 2 to 3 weeks, very strong communication from folks, our epidemiologist, Dr. Carter, and our Commissioner Renee Cohen-Mitchell, and of course, Governor Lamont has done a really great job, as well as legislative leaders. We've all been in contact on a daily basis, on a almost an hourly basis. We have conference calls all the time. So we're all talking about what is being done on a short term and a medium term. Today, just a little while ago, the state was approved by the SBA for those emergency loans up to $2 million, which is great news. We're extending some deadlines on the state level for CHESLA loans, also for for some of the Small Business Express loans. We're going to be also doing a package, I would imagine, once the legislature can reconvene again and figure out once what is being done, and that's more long term. But we're talking every single day about what we can do right now to affect people who are impacted and help blunt the trauma. We're looking at what we can do in the medium term for the same thing, and then the long term is going to take something much bigger. I imagine the federal government is going to be doing something as well. Once the U.S. Senate passes the bill that the U.S. House passed, that will provide some money to Connecticut as well, and that'll be a help. It's not a perfect bill by any stretch of the imagination, but it'll help. So I'll yield to Representative Dathan for further comments on it, because I think she just had a chat with her leadership as well. But I can just say that on a bipartisan basis, we're all in contact with each other, talking all the time.
Oh, hang on. Let me. Oh,
Sorry about that.
No worries.
So just to let you know, my caucus, the Dem House Caucus, had a call this afternoon to kind of talk about forward steps and what we can do to help small businesses. And as Senator Duff said, really the big focus is at the federal level, because this is not a Connecticut problem. This is a global problem, and the federal government's going to have to be the lead on this. What we're trying to do, as Senator Duff talked about here in Connecticut, is we're trying to extend deadlines. We're trying to have a holiday for repayment for DECD loans. We're also ensuring that our local utility providers do not shut off services. I know the Attorney General has been very strong with price gouging and ensuring that people are not taking advantage of the situation. I'm sure everyone read in the New York Times over the weekend about the two gentlemen who have hoarded something like 70 or 80,000 bottles of Purell and trying to sell those for a lot of money on eBay and other Amazon networks. And so, we have a good, strong leadership up in Hartford. Bob's one of the key members of the leadership up there. So he's involved with the more day-to-day, hour-by-hour conversations than I am. And I'm just trying to make sure that information that I hear and resources that I have, I'm just kind of trying to disseminate the information. I know I sent some information out to my mailing list today on resources from Department of Labor. If anybody is not on my mailing list and would like to get that information, please let Justin know, and I will make sure I forward that information on to you. But you can sign up on my mailing list so you hear. I know Bob and I Senator Duff and I have a very strong Facebook and Twitter kind of presence, and we're trying to push out information as much and as quick as we get it, because we do get information, hour by hour as well. So that's pretty much it. I'm going to go back on mute.
Okay. One more question here, and then regarding these state government related stuff that just popped up. Where is it? Have there been any discussions at the state level in regarding nonprofits during this period of time?
Lucy, you want to answer that?
Sure. I was just going to say some of the loans that Senator Duff talked about a second ago, the SBA loans are eligible for, and they're very low interest rate loans, up to $2 million. And they are federal government backed sort of loans. I do have the information on that, but if you do want to get information on that, you can call. There's a number of 1-800-659-2955, or you can apply online at www.sba.gov/disaster. And all of these are found again on I just put this on Facebook a couple of hours ago, but this was announced this afternoon that that program went through. Again, looking at what we can do for ensuring that the utilities and all those other things that I talked about earlier also affect small businesses and not-for-profits as well. Senator Duff, do you want to add anything to that I missed?
No, I think you got it all. Thank you.
Thank you so much. I'll post this online, and in the comments, I'll flag some of this information that was talked about so people can jump to different parts of the video if they'd like to learn the phone number or the website information or any of the top line thoughts you had. So that's easy for people to find the information that they're trying to find. So we just have a few minutes left here. Is there anything left that they'd like to ask Kim here? While we have maybe 5-7 minutes or so left here. Does anybody want to ask anything, or does Kim, if you have anything you'd like to finish up or anything that you had on your mind as you were speaking that you didn't complete yet, by all means.
I think Kim was great. I appreciate her being on.
Thanks.
Thank you so much, Kim.
Thanks. I'm getting a lot of questions from like Justin, who I hadn't talked to in a long time, but people reaching out because they don't know so many epidemiologists. So if I can be your epidemiologist, I'm happy to help you guys out.
That's fantastic. Thank you so much for your help. Just checking the comments here.
I just wanted to add in something. Natasha had a question about Norwalk hospitals. I know we are, Senator Duff and I, and all of the sort of key people in the Norwalk emergency management team, which would include, the EMTs, the fire department, the schools, the police, and Norwalk Hospital are meeting weekly to talk about what they're experiencing. Norwalk Hospital, I've been extremely impressed just with my experience so far in this crisis. They have been on top of the situation. They have talked about what they're doing to prepare. I know that they are looking at various sort of drive-up testing facilities, and I'm hoping that we will get some information. And again, I will be posting that. I'm sure Senator Duff will be as well when that kind of comes live. But there are phone numbers. And again, if you want to email me, I can send you some of the Norwalk Hospital phone numbers for questions. But I think if you have any general questions, the 211 state number is also United Way is a good resource as well.
And also, I'd like to add just a shout out. Obviously, I can't say anything that I've heard, but my wife is a nurse at Norwalk Hospital, and just want to give credit, whoever watches this once this is posted, to all of the nurses and the nurse practitioners and the doctors and the paramedics and healthcare workers throughout. They're on the front lines here, and we wouldn't have a chance if it weren't for all these people giving their time and energy to this. So I'm just going to add that. One more thing popped up. Can we ask to do a presser to reassure Norwalk Hospital? Has there any been word on any on a press conference at all with regards to the hospital to sort of give some guidance or reassurance to people who might end up there or have to use their services at all?
I guess I can answer that a little bit. They were part of our press conference that Representative Dathan and I were at a week ago Thursday. I know they're all working very, very hard there. As you know, with your wife, everybody's kind of on overdrive here with everything. So I would just, kind of what was said earlier, I would let the hospital be the hospital, let them do what they're doing. Listen to the advice of doctors like Dr. Fauci and others who are really speaking well on this issue and straight talk. I think we're in touch with the hospital, and I think the only issue that the hospital has is the same issue all hospitals have, which is if we don't flatten this curve, they all become overrun and it becomes overwhelmed and taxed too much. And so therefore the whole system collapses. So everything will run okay if we all do what we're supposed to do. If we don't do what we're supposed to do, then the hospital and the whole healthcare system collapses, and that's the problem. So they can assure us right now that everything's okay, but if the trend lines go the wrong way because we're not doing what we're supposed to do and being responsible, then whatever they write on paper or say out of their mouths goes up in smoke because it just doesn't matter at that point. And I don't know if Kim wants to uh, 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 chime in on that at all or not. From her perspective, I'm not sure if she'd want to or not, but just from that standpoint, it's really important that we all play our role here and be responsible and do what we're supposed to do.
Yeah. So Kim, I think based on what just to riff off of that, can you reflect on sort of what flattening the curve is? We referred to it a few times during this conversation, and you gave a pretty good analysis of it earlier. But is there a short, sweet version for people who don't have the patience or energy to research kind of what that means and how important that is?
Yeah, maybe. I like you were saying you were going to sort of pull together some resources. I could send you a link to include as a resource and talking about flattening the curve. I mean, it goes back to what you said earlier in terms of sort of when is the peak going to happen. And just like Senator Duff just said, that really is up to us. So if we are really great at implementing these social distancing measures and we just keep to ourselves and we stay home as much as we possibly can and we avoid contact with other people who can then avoid contact with other people, we're really going to help flatten this curve. So it means we're going to spread out. It doesn't mean that no one's going to get sick, but it means we're going to spread out when the infections happen, so that it's only a few people who are sick at a time, which is exactly what our healthcare system and hospital systems can handle, and that's what we mean by flattening the curve. So it won't be everybody sick all at once. It means eventually we may all get sick, but it'll be over a long, drawn-out period so that when we need healthcare, we can get it.
That's really helpful. Did you have anything else you wanted to add based on what Senator Duff had to say, or anything else that has been brought up?
I do agree with what Senator Duff was just saying. I do fully support you following anything that Anthony Fauci says, and anything coming out of NIH. The CDC website is a great resource for information, and they should be updating it nearly constantly. For news feeds that are really science-based, Stat News has been doing a phenomenal job covering coronavirus in particular. Helen Branswell is their lead on coronavirus in particular, and she's just wonderful. So if you really want sort of a science-based understanding of some of the trickier concepts that are involved with the current coronavirus, I would recommend Stat News in addition to these other resources like CDC and NIH and WHO, of course.
That's great. Well, I will wrap it up there. I will post this online, and I'll flag all the websites that have been brought up in the phone numbers that have been brought up. But this has been super helpful. Thank you so much, Kim, for your time, and Senator Duff and Representative Dathan. This has been super helpful. I'm so grateful that I have friends and neighbors and acquaintances that are really smart and engaged in this. It's great to know you guys are all around and here helping us.
Thanks, Justin.
Thanks, Justin.
All right, everybody, have a great evening, and bye-bye. Have a good one. Bye.
Thank you, Justin.
All right, everybody.
Bye.
Have a good one, evening.